That's working. I'd like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant,
Here.
Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Bond, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Mr.
Here.
Chairman, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? Chairman Williams, you're recognized.
Thank you, Chairman Terry. I couldn't help but notice that Chairman Zachary's better half and his son are in the audience. I see Holly and Tyson Zachary back there. So don't take it out on Chairman Zachary in front of it if his bill is really bad in front of his family. Thank you very much.
All right, thank you. Any further personal orders? Okay, seeing none, we have 9 bills on our calendar, and I'm going to take a few things out of order. Item number 1, House Bill 2665 has been rolled 1 week. Item number 9, House Bill 2705 has been rolled 1 week. And without objection, I've got a bill to present another committee, so we're going to take up item number 7, House Bill 2171, and I will pass the gavel.
All right, I have a motion and a second on House Bill 2171. And is there an amendment?
There's an amendment, Amendment 15056.
Okay, and that's the amendment we have. There's been a motion and a second on the amendment. Chairman Terry, you are recognized on the amendment.
Okay, thank you, Chairman Committee. Federal law was updated in 2020 to allow opioid treatment programs to report to state prescription drug monitoring databases like our CSMD, and this bill would line us up with federal law. The amendment put some clarification language in there because inpatient treatment is part of a different program. So with that, I'd be happy to answer any questions.
Any questions of the sponsor? Seeing none, are we ready for the question? Any objection to the question? All right, we are voting on the amendment 015056. All those in favor say aye.
Aye.
All those opposed? The ayes have it. The amendment is on the bill. On the bill as amended, Chairman Terry, you are recognized.
Renew my motion.
Any questions of the sponsor on the bill as amended? Seeing none, any objection to the question? Seeing none, we're voting on the bill as amended. All those in favor say aye.
Aye.
All those opposed? All right, the ayes have it. House Bill 2171. We'll move on to calendar and rules. Thank you. And with that, I will pass the gavel back.
Thank you. I'll be called to another committee here in just a second to present, but thank you for your indulgence. That brings us to item number 2. And let's see. Okay, Representative Hall, you are recognized.
Thank you, Mr. Chairman. Currently, the Department of Health hires the executive director of the Board of Pharmacy. House Bill 2662 changes all of that. It gives the Board of Pharmacy the authority to hire and fire the executive director. And with that, Mr. Chairman, I renew my motion.
Okay, I believe there's an amendment.
There is a drafting code, Mr. Chairman, 015567.
Okay, can I get a motion? Okay, you have a motion, a second on the amendment. Okay, let's get the bill in proper order. So all those in favor of amendment 015567, say aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. Any questions for the sponsor of the bill? Okay. Seeing none, we are voting on House Bill 2662. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 3, House Bill 1976. Leader Johnson, you're recognized.
Thank you, Mr. Chairman. House Bill 1976 is introduced, exempts a veteran of the United States Armed Forces who was trained as and certified as a medic or a hospital corpsman from the initial license fee of the Emergency Medical Service Board.
Any questions on the bill? Seeing none, we are voting on House Bill 1976. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chairman. Committee.
That brings us to item number 4, House Bill 702. Leader Lamberth, you're recognized.
Thank you, Mr. Chairman. And the amendment code 015167 makes the bill.
Okay. I need a motion. Hey, you have a motion, a second on the amendment. We are now on the amendment.
Yes, sir, Mr. Chairman. Would you like me to describe it now or wait till it's on the bill?
Okay. Without objection, we can put this on the bill. All those, we're going to vote on Amendment 015167. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. This bill comes from a friend of ours in the Senate had a constituent of theirs that is in their mid-20s and wanted to get a kidney transplant and needed a kidney transplant and had family members that were willing to be tested to provide that transplant. And this young person had been through COVID, had not been vaccinated, and when they got to that checkbox on the evaluation, they were told by the doctors at that facility that they would not do the transplant simply because they were unvaccinated for COVID. That is certainly a consideration that doctors should take into account. That's part of the workup that they can do. And I know we've had that conversation in subcommittee, but this just says it can't be the sole reason that you're denied an opportunity for a transplant. It could be a consideration, but it can't be the sole reason. And Mr. Chairman, that's what the bill does.
All right. Do we have questions of the sponsor of the bill? Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you, Mr. Leader. You are much loved and admired. Thank you for all of the personality that you carry in this bill. I think you raise a very valid point. You raise a very valid point in the sense that this should not be the sole consideration. However, it is my obligation to my profession to state that there is a genuine medical concern in giving a transplant to a patient who is not protected against infections. Because when a transplant organ is given to a person, they are going to react to that organ by, their body will work to reject it. And
That was your conscience calling.
I think you arranged it. Thank you. Okay, the body will reject it, and because for that, avoiding rejection of the transplanted organ is paramount at that time, and for that reason, anti-rejection therapy is necessary, and those drugs make it possible for transplantation to be accepted and for it to happen. Those drugs also take out the immunity of a person. When we take out immunity, that person is more prone to infections that an immunocompetent person would not be bothered by. So that is a medical reasoning to protect people against infection with all means possible that there would be concerns upon giving a transplant, knocking somebody's immunity out, and leaving them open and susceptible to infections. But again, Mr. Leader, thank you for letting me explain that. I think it needs to be on the record. Thank you. Thank you, Mr. Chairman.
Thank you. You're recognized.
Dr. Kumar, thank you. And obviously you are extraordinarily wise and knowledgeable in these areas, and I trust your evaluation of it. However, I'm not saying that it can't be a part of that evaluation. This bill just says it can't be the sole reason. And so I know we, as friends, respectfully disagree on this issue, but I would prefer for not just one single checkbox to be able to knock somebody out from being able to even be considered for an organ donor transplant. And so, again, thank you for sharing your background experience on this. I deeply appreciate and respect it. Just humbly disagree in this particular instance that this would just say it can't be the only consideration and thus knock somebody out of that possible life-saving procedure.
All right. Representative Hall, you recognize?
Call for the question, Mr. Chairman.
Is there objection? I see objection. Do you withdraw the? Would you withdraw? Okay, is withdrawn. Representative Keem, you recognize.
Thank you, Mr. Chairman. Leader, in your description, I don't believe I heard you say the person had COVID, but they just had not had the vaccination. Is that correct?
You recognize.
No, sir. It was just that they had not chosen to be vaccinated. I will tell you, in the circumstance we were talking about, the young lady in question had a serious bout with COVID, and that was kind of her issue. She said, look, I've chosen not to be vaccinated. I'm very young. I've had COVID. She felt like she has enough natural immunities to be able to sustain anything, and was having that conversation with the doctor when they just cut the conversation off and said, ma'am, if you're not vaccinated, it doesn't matter what else is going on. We got a checklist, and if you're not vaccinated, you cannot get an organ transplant. I just don't think that's appropriate. I think there should be a more in-depth conversation on that. It should take the whole patient into consideration. And in the subcommittee, we had a conversation as to what's going on nationally on this. There is a best practices. It's not a requirement. It is a best practices that comes from these institutions that a patient should be vaccinated for COVID and other vaccinations. But even with that standard, it doesn't say that it's the sole reason. And that's why we structured this way, to say, look, we just want to make sure that doctor and patient are able to have a full conversation on it, and there's not just one thing that knocks them out.
Thank you, Mr. Chairman and Leader.
All right, thank you. And just to clarify, that particular physician, to our other chairman's point and to this point, if that particular physician believes that by the chemotherapeutic agents that you would be getting it would prohibit you or should prohibit you from getting it, they could document that and then not give it to you. It just can't be for the one reason, correct? Yeah, you're right.
Yes, sir, Mr. Chairman. There are multiple other reasons that they could say they're not comfortable working with that patient. It just can't be the sole reason.
Thank you. Representative Mitchell, you recognize.
Thank you, Mr. Chairman. And I understand the dilemma that you say these folks were in, and it pulls on the heartstrings. But I mean, let's be honest. You and I went to law school. We didn't go to medical school. We've got to rely upon the doctor's professional opinion. You know, we always get in here in committees up here all the time. Oh, the malpractice costs. Well, maybe we're contributed into it by non-doctors starting to practice medicine. I just think if the doctor thinks it's in the best interest of the patient not to go forward with something, then we don't need to get involved in that.
You recognize.
Yes, sir. And I'm not asking to make a medical determination and not asking this committee to make a determination medically. What this bill would force is a full conversation on that, so that that doctor and patient genuinely engage in that full conversation about every aspect of the patient, not just the one aspect. And so what you described is literally the conversation that it would force, so that there's not a box that's checked that says, hey, we go no further. We're just requiring that they dig a little deeper and take that full patient into consideration in every aspect, and then make a determination, because we are talking about an organ transplant. So without a transplant, many of these folks, there may be a risk that they could die of COVID, but without an organ transplant, many of them will die. I mean, they have a death sentence on them. And when you're dealing with that kind of circumstance, I just want every box checked, not just one to stop the conversation.
Representative Mitchell, you recognize.
And I agree with you. It's just, an organ transplant is such a precious thing. Getting that match and the limited number of organs that are available. I mean, step back from that situation. You know, let's give that person getting that organ transplant the best shot, so they don't have a rejection. And, you know, maybe the person who's offering up the transplant maybe steps back and says, hey, you know, for my loved one, maybe I should get a vaccine. You know, let's do everything we can to make certain that person has the best chance of survival. That would make the most sense, I would think.
You recognize.
With all due respect, that's what this bill does. I mean, it forces that conversation, and there's nothing that stops the doctor from having that conversation with the patient to say, look, to maximize your chances here, I recommend you go get a vaccine. We're going to wait X amount of time. We're going to go forward. But again, it should be a full conversation. So I don't disagree that conversation should happen, and this bill does not prohibit that conversation. It more forces it, literally.
All right, thank you. Representative Clemens, I believe you had a question for legal. Is that correct?
Yes, Mr. Chairman.
Okay, without objection, we will go out of session to hear from legal services.
Thank you, Mr.
You're recognized.
Thank you, Mr. Chairman. So my question is, and I was looking in the here, is there another section in the code that gives a special consideration for anything such as a vaccine, COVID-19 or otherwise, with regards to qualification for organ donors?
Not that I know of.
Ritual Bajoy, Office of Legal Services. In regards to vaccine, whether there's a law that touches on both vaccines and organ transplants, there's no specific law in the TCA like that. However, the Title 68, Chapter 31, 101 through 103 prohibit, similar to this bill, prohibit discrimination in terms of whether someone is qualified for a transplant or not on the basis of disability. So that is another, that's a prohibition that already exists on covered entities in regards to transplants.
You're recognized.
Thank you. The section of the code to which you refer covering the basis of disability, I mean, that's addressing something that is not the option of an individual qualified recipient, correct? That's simply dealing with a disability that an individual has no discretion over, or am I mistaken?
You're recognized.
It prohibits discrimination on the basis of disability, which is defined by reference to federal code at 42 USC 12102.
You're recognized.
Which, to my knowledge, is something that would, is something someone can't control, or whether they've incurred some sort of disability, not something that was they chose. I'm right. Am I right?
All I can say is disability. So that definition is a physical or mental impairment that substantially limits one or more major life activities of such an individual. Can't really speak to how the individual gets such a disability.
Right. Okay. That answers my question. Thank you.
All right, thank you. Without objection, if there's no further questions, while we're out, while we have legal, that's right, okay. Without objection, we'll go back into session. Representative Byrd, you recognize?
Thank you, Mr. Chairman. I know when you do get an organ transplant, you go through all these multiple tests and you get scored. Would they not just give you a bad score for not having the vaccine, and that will make you fall short of being at the top of the list?
You're recognized.
This bill does not preclude that. I mean, we leave that as an option, especially since others had mentioned the organ donor list. Where it's really going to help is specifically in the circumstance on the folks that brought the bill is if you have a private donor. So that's not a score system from my understanding. There's no score really evaluated with that. There's still a consultation with the doctor on whether or not you'll be a good recipient, everything else. I mean, so there's still a process they go through. But yeah, I mean, there's nothing in this bill that precludes, not being vaccinated from reducing that score for purposes of getting a organ donation. But again, it can't be the sole reason. It can't be the only thing that is just 100%.
Okay, thank you.
Thank you. Okay. Okay, any further questions? Okay, seeing none, we are voting on House Bill 702. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and members of the committee.
Thank you. That brings us to item number 5, House Bill 2156. Chairman Zachary, you're recognized. You have motion second.
Thank you, Mr. Chairman. Mr. Chairman, I do have an amendment drafting code 15324.
Okay, we have, yes, drafting code 15324, and that rewrites the bill. So without objection, let's get that on the bill. All those in favor say aye. Opposed? Ayes have it. Okay, we're on the bill as amended.
Thank you, Mr. Chairman and committee. Members, this is just an administration cleanup bill from the Department of Health related to some legislation we passed during the special session. They felt like there needed to be just a little more clarity related to one of those bills. Does three things, and it's simple, very simple. Clarifies the Department of Health retains the authority to carry out its routine mission for public health. Number two, it prevents confusion over disagreements between the mayors and the commissioner regarding the appointment of the health officer. And then number three, just clarifies that the governor does have the authority to issue executive orders for all 95 counties during a state of emergency. There was some question about the 6 counties, the 4 metros that came up during the pandemic and the state of emergency. It just brings clarity to that. And that's all it does.
Okay,
And with that, I'll take any questions.
Any questions for the sponsor of the bill as amended? Seeing none, we are voting on House Bill 2156. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 6, House Bill 2162. Chairman Eldridge, you're recognized. You have a motion, a second.
Thank you, Chairman.
There's an amendment.
There is an amendment, yes, sir.
Okay, rewrites the bill, Amendment 015048. Is that correct?
That is correct, sir.
Okay, you have a motion, second on the amendment. Let's get this bill in without objection. Let's get this amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Mr. Chairman, I'd like to make a request for a roll call vote on this bill, please, sir.
We just voted. That would require, we just voted to put the amendment on there, so you can no longer
Okay.
call for that.
Okay, sir. Thank you.
You are recognized on the bill.
Thank you. House Bill 2162 is dealing with unlicensed facilities for the elderly. This has become a real issue in Tennessee in the last little while, and it's impacting some of our most vulnerable people. Most of the residents in these homes are over 60 years old. They're not able to take care of themselves. And many of them are not eligible for Medicaid or Medicare at this point. So they're kind of fell into a gap. This bill is seeking to create a registry for these unlicensed facilities to add some transparency for identifying bad actors, while also empowering families and people to make a decision about where they're going to go if they want to go to one of these homes. The bill also it furthers the ability of the state to act against unlicensed facility operators when individuals under their care are subject to dangerous conditions. The enhanced criminal penalty for repeat bad actors keeps these folks in this type of facility safe. The bill makes for operating an unlicensed facility after publication and notification that they've been placed on a registry. So they have a chance to make this right in there, but it would make it a Class D felony. And I'd like to give you all a little background about this bill. Last year, I received a phone call from the coroner in Hamlin County about I went out to a home that had about 16 people, 13 to 16 people in it. This is like a brick rancher, a 1,600 square foot rancher. There was raw sewage in the front yard. The lady that had passed away, of course, that was what opened the door for him to get in there and to see the place. And then he turned around and called me about it. The house had no egress windows in the bedrooms. There were 6 cots in the living room that these people are she was running a small cottage industry in this house. And the care of the people there, one young man had traumatic brain injury. There was some of them that were bedfast. There were no smoke detectors in the house. There was no fire suppression whatsoever in the house. And there were even some residents living downstairs in the basement. This bill is designed to take care of situations like this. The lady that operated this house has done it multiple times before in Hamlin County over the years. She has continued to do so because it's a moneymaker for her. And we realize that there is a need for homes for people that fall into this situation, but there also needs to be a way that we can go in and check and see. And what took place down here was we talked to several different groups, and it seemed like nobody really knew who was in charge of what was going on. So the administration formed a strike force to study what was happening. And I appreciate them taking an interest in this. I appreciate them taking the time to look into who is in charge for these people. And also want to thank the Commission on Aging and Disabilities. They've worked on this bill to set this right. This bill is about a registry to control some of these bad actors. And with that, I will take any questions.
Leader Gant, you're recognized.
Thank you, Chairman and Committee. This legislation is brought by our governor and administration, and it's addressing a very critical problem that our state is beginning to face. So I appreciate the sponsor carrying it for the administration, and I would encourage this committee to support this wholeheartedly. Thank you, Chairman.
Thank you. Representative Clemens, you're recognized.
Thank you, Mr. Chairman, and thank you. This bill, the spirit of this bill is good. My single concern is that one of these sections is not like the others. And Section 2, out of nowhere, allows a limited licensed plumber to handle the installation of the sprinkler systems. What is that section doing in this bill? It doesn't seem to address any of the concerns that you raised.
I think we have some folks here to speak on that, but the thing that for me personally is, and being in business, I know we like to know that people are doing the right thing for the right reason. I don't know how the people with fire suppression, the sprinkler systems, they would be that interested. I don't even know that Hamlin County has a fire suppression company in town or a sprinkler company. So I think it was just making sure that these homes can be taken care of in a timely fashion when it's brought up.
You recognize.
Thank you, Mr. Chairman. My concern here is I think you're trying to close these facilities down, or you're trying to bring these in or get them registered and make sure we know how to regulate them and that these folks are being taken care of. But then this Section 2 is kind of plopped in the middle of it to allow just local plumbers to install these sprinkler systems, making it easier on these wrongdoers to come into compliance, when I think the purpose of the bill is to really regulate these entities, make sure they're not operating out there in a gray area, and to make sure our folks are taken care of and nobody's being taken advantage of. And that seems to me to be the spirit of the bill. And at least as I've read it and you presented it, which you did well, this section would you be amenable to amending that single section out of the bill? Because it seems like it's misplaced in this legislation.
You're recognized.
Chairman, I believe there's some people here to speak concerning that. Would you consider going out of sessions to hear from them?
All right. Without objection, there are several people here that are on the list to testify. So we can go out of session. So without objection, we'll go out of session. And Chairman, who would you like to call up that was on our list? Chairman? Okay.
Mr. Chairman, members of the committee, I'm James Dunn, Executive Director on behalf of the Commission on Aging and Disability. I'm here today on behalf of the governor, the strike force, our various departments and agencies who have worked on this strike force. And I want to, number one, thank immediately the Sprinkler Contractors Association and Holly Kirby, whom I have spoke with about this bill. And I want to thank all of you because I know our members have really, or not our members, our liaisons have really been wearing you out. When we found out that the Sprinklers Association took issue with Section 2, of course, we took it upon ourselves to do our best to provide you with accurate information. We certainly respect the will of the General Assembly and believe that you need to be able to make informed decisions. Section 2 complements the bill, and it complements the bill because currently plumbers are not allowed to put in place sprinklers. As part of our task force, we have found over 100 facilities so far that are not in compliance with licensure. So it is more and more difficult, in particular in our rural areas, for people to get those sprinklers put in place. And again, the provision in there brought by the Department of Commerce and a good idea that was recommended really is intended to bring more people into compliance. So the bad actors don't do what they're supposed to do anyway, right? Those are the people that we're trying to get at. But for the people who are trying to do what they need to do, we need to make it easier for them. And I will tell you, the Sprinklers Contractors Association will tell you that there are different requirements on training, that there are different requirements on insurance. This is all true. This is all true. But we are for competition. We are for competition at TCAD, and we believe, frankly, that more people who can put sprinklers in place, the more facilities that we will have, then the more protected that our aging population, our elderly population, our disabled population, and mental health populations will all be protected. But to Representative Eldridge's point, the primary meat of this bill really is the registry. And this doesn't change anything regulatory-wise, so to speak. So mental health Department of Health, who currently regulates these licensures, if they adjudicated someone and determined that they were not operating with a license, at that point of time, TCAD, then as a repository, would take that information. It would be put up on a list. The public would be able to see it. Of course, there's due process and everything for people to come off the list if they were put on there, they felt wrongfully. And then moreover, and this is why I believe that the DA's conference supports this and the AARP, if a person should operate subsequent after being on that list, they would then be subject to a Class D felony. Extremely important because right now it's only a Class B misdemeanor to operate without a license. And in many circumstances, as the representative has testified to, we find that the conditions in which our elderly and vulnerable populations are housed under are very deplorable. This would not impact, by the way, anyone who is caring for a relative. It would not impact those in any kind of way. But I stand by if there are any further questions. And I thank the chairman and members of this committee.
All right. Representative Clemens, would you like to ask a question?
Yeah, I mean, it's my understanding in reading this legislation that the intent of this is to protect individuals who would be in these homes, bring these facilities into compliance and ensure they're complying with the rules set forth by the state of Tennessee. And now you're talking about market competition. It just seems odd to me. I haven't heard from the Sprinkler Association. I didn't even know they were working this bill, but you know, this, you can't help but see this section jump out. And I guess, yeah, we want all these houses in compliance. We want them to have sprinklers, obviously, but there's a requirement in the code for these facilities to have sprinklers installed by people trained to install these systems. So it just seems to be a glaring beacon of a section of a code that, as explained, its purpose, its spirit, and its intent, it just doesn't fit. And I don't know what else you can add that would convince me otherwise, but go ahead.
You're recognized.
Well, I would just say, Representative Clemens, number one, thank you for your concern and thank you for your diligence on this bill. It's an important policy. I would say to you, we've got 1.3 million Tennesseans who are age 60 and older. That's a seventh of our population. A lot of folks talk about how we need more money to do this and that. Some of that's true. But what we need more than anything are new systems, because if we do not start establishing more places for these people to be housed and more caretakers to take care of these folks, when that population gets to 70, 75, we're going to be in a real bad situation that's extremely ripe for additional criminal activity. And we're already seeing it. So what we're trying to do, and what the governor, I believe, is trying to do, is proactively mitigate this. And so one of the things that we can do to do that is to deregulate in a very narrow way the installation of sprinklers. And all we're asking for really is that if there are 5 or fewer folks in a residential facility, that plumbers in those scenarios would be able to put in place sprinklers. We're not getting it commercial. We're not getting at the larger facilities, et cetera. So we believe that this is a good compromise on the front side. And that's why we have told the Sprinkler Association, who has asked for additional provisions and compromises, that we intend to move forward with the bill as it is written. I hope that answers your question, sir.
Did you have another question, Representative Clemens?
Yeah, I mean, it just further emphasized that what the spirit and intent of this bill is, and I'm familiar with the aging population of the state of Tennessee and the percentage thereof. And I think the heart and soul of this bill goes to that. I just think this part tucked in here has no role or doesn't further the spirit of the legislation in that way. I would just like to see it be a separate piece of legislation. And that's why I asked if the sponsor would be amenable to amending it out, and we can run it as a separate bill and just vote on that. And that's a separate issue altogether, but it just seems misplaced in this bill. That's my point. Thanks, Mr. Chairman.
I believe if we could, I'm at the will of this body and of course Representative Eldridge, but I believe there's ample support for this bill in the spirit of what it's trying to accomplish. And I would encourage this committee to support it. And I would also say to you that the Sprinklers Association is here. And moreover, so is Mr. Gary Farley, the Assistant Commissioner of the Department of Commerce, who I know will testify that this is not an issue on a safety matter and that they would be okay with plumbers installing these sprinklers. Thank you, Mr. Chairman.
Leader Gant, you recognize?
Thank you, Mr. Chairman. I'm in the insurance business, and I would love to carve out my competition. And that's exactly what we're doing right here. And Commissioner, if you could answer this question, in most counties and cities, they have what they call code enforcement. Is that correct?
Yes, sir.
And don't they inspect these installations?
Indeed, they do.
Okay. Thank you, Mr. Chairman.
Thank you. Representative Mitchell, you recognize?
Yeah, thank you, Mr. Chairman. I was told by the administration and by your statements that this was to bring people up to compliance. What you're doing is not bringing people up to compliance. You're lowering the bar so they can get to compliance. I mean, in talking about competition and free market, I really don't care about competition, free market. I care about the safety of those 5 lives or less that you're talking about. It's only 5 lives in these homes. I mean, that's a ridiculous statement. If it was one of your loved ones as one of those 5 people, we passed the laws up here for the fire sprinkler contracting licensing program for a reason. We have licensing contractors, licensed electricians for a reason. And if their work is shoddy, thank God the sprinklers kick on and fix that problem. So I am just appalled that I wasn't told about this section of this bill when the administration came to me and told me about this bill. The bill in and of itself, this registry, is great. But to stick this in here, it is abhorrent. I mean, I can't believe someone would stick this in this bill.
Representative, I sure do appreciate your passion. I will tell you, I disagree with you. I disagree with you adamantly. And I will also say that our staff reached out to every office here. Now, everyone is busy, so we're not always able to meet with everyone. But we have tried to meet with everyone. And I would just tell you that this bill does go a far way to protect folks. And to the assistant leader's point, who works in insurance and knows these things well, and many of you have worked on local governments and know these things well. This is all subject to codes. So whether the plumber puts the sprinkler in, whether the sprinkler contractor puts the sprinkler in, the codes are all the same. Thank you, Mr. Chairman, members of the committee.
All right. Thank you. And Chairman Whitson, recognized.
Thank you, Mr. Chairman and Director Dunn. Thank you. And I just want to let you know, your staff did reach out to me and they articulated both sides of this issue and they did a great job doing it. I think this is probably the best bill that we will have before us this session. Nothing more important. I know a family reason that we did this or that we're doing this. And Representative, I really appreciate you bringing this. My question though is this, did I hear you correctly say that plumbers are not certified to install sprinklers?
That is correct right now. But I will tell you, I am not a subject matter on the issue. Mr.
Okay.
Farley, who is in charge of the fire marshal's office, is here and perhaps could speak to it a little bit better. But that is my understanding. Plumbers currently cannot install the sprinklers as sprinkler contractors can. Again, that's why the provision I think that is in there is very narrow. It is for residential units with 5 or fewer residents.
And I understand that 5 people are just as important to me as 6
Sure.
people. And I agree with my friend, not as passionately from Davidson County on this concern. I just, if this bill is that good, I don't want to see it derailed for this issue. And I think it's very important we resolve that before we move forward. I want to support this bill. I want to sign on to it. But if we're going to do it, we got to do it right. And we had a saying in the Army, if you want it bad, you may get it bad. Thank you.
Representative, you're a very compassionate man and you've always been kind to me. I appreciate it. And you've always done a great deal for the elderly and disabled population. You're known for that. We do appreciate your support on this bill. I will tell you the bill has been thought about in depth over the course of time, and it is in a good stature, I do believe. I do believe. And so we would ask to move the bill along if we can. Thank you.
Thank you, Representative Hakeem. You're recognized.
Thank you, Mr. Chairman. Representative Eldridge, I truly commend you for what you're trying to do and the heart of this bill. I think we all support. But the more I listen, the more questions I have in regards to the sprinkler piece. Well, one of the things I heard was, if I heard it correctly, the sprinkler persons who are qualified to do it now, didn't have a problem with the plumbers doing it. I'm also hearing that the plumbers are not certified. And I would hate to see a quality bill like this held up because of concerns about this. So I guess what I'm getting at, is it feasible or possible to separate this so that, and we have more time to study and understand what is happening in regards to the sprinklers?
If I may just speak to this, and this goes to Representative Whitson's point as well. I'm sorry, if you, does the chairman need to recognize someone else?
Now you're recognized.
Thank you, sir. As lawmakers, if you so decide that these plumbers can do this, then they can. They're already laying water lines. They're maybe not putting sprinkler heads on them. Maybe they're putting other faucets on them and different things. A mechanical license, a plumber that does that can put in place gas lines subject to explosion. All we're asking for is that they're able to put sprinkler heads in, sprinkler lines in these small residential units with 5 or fewer residents. And Representative Whitson, to your point, to both of your points, we've got over 100 facilities right now that we have determined are out of compliance in the state. About 8 to 15 people per facility. It fluctuates. Some of them smaller, some of them larger. If we do nothing, these facilities will continue to operate without a sprinkler system at all. It is not cost effective for them to solicit or to procure sprinkler installation when there are so limited people who can actually deliver this service. So I would say to you, under the cost benefit analysis, people will actually be safer if you pass this with this provision in here than they otherwise would be. And again, Assistant Commissioner Farley, who's in charge of the Fire Marshal's office, no doubt will tell you the very same thing. Thank you, Mr. Chairman, members of the committee.
Mr. Chairman. Thank you, Mr. Chairman.
You recognize.
It may not be the intent, but I thought I heard the presenter speak in regards to 8 to 15 persons in a unit. And now I think this bill is talking about 5 or less. And I guess we're talking about 2 different forms of qualifications. And I think we need to hear from, I'm going to use the term, both sides of the issue on this. But at the same time, I wouldn't want to see this bill held up because of this issue. Thank you, Mr. Chairman.
Mr. Chair, members of the committee, what I said was on average. DID and mental health both have group homes who include folks who are under this number of what we've said. I think three or more. Again, these are non-relatives. So this is putting a dent in the situation. But again, we're talking about, we've got 1.3 million Tennesseans out there. You know, if you don't have the $6,000 to $7,000 a month to be in an assisted living facility, if you are not in Medicaid, which is the bulk of this population, as this population ages, if we don't start to do more to expand on facilities, group homes that can house these people, we're going to be in real trouble. So I would encourage you to act sooner rather than later on this. I believe the bill is good. I don't want to belabor the point too much. Thank you for your indulgence.
Speaker Marsh, you recognize.
Thank you, Mr. Chairman. I just have a simple question is, do the plumbers want to do this job? Can they do the job? And what is the difference in cost from a plumber that can go in? I know some great plumbers that I feel like could do this. What would be the difference in the cost from a plumber doing it and a registered licensed group?
You recognize.
Mr. Speaker, it's always very important to me that I give you good and accurate information. I do not know the answer to that question. We can find the answer to it. We can get it back to you. I don't know if Mr. Farley would know that or not. I do not know the answer. I'm happy to try to find it.
Speaker, any more questions?
I think that if we could, I'd like to hear from Chief Farley, see if he could tell us the answer to that.
Okay. Do we have any further questions for Dunn? Okay, wait. Let's finish with Dunn. Before we got some more questions for you before we move on. We got several people on the list here. Chairman Kumar, you recognize.
Thank you, Mr. Chairman. My comment was more relevant to the bill itself. So if you will kindly, when you're back in session, give me a chance to.
You are on the list.
Thank you.
Chairman Jernigan, you recognize.
Thank you, Chairman. Director, I'm 1,000% for this bill, 1,000% against this provision. Unless plumbers are going to be able to do it for everyone, for every industry across this state, and we're just going to carve it out for people with disabilities and they get a lesser. And that's wrong. Until we do it for everyone, it's certified for a reason, but they're not going to be certified for this population. And that's offensive. It needs to be across the board. We need equal protection across the board. That's the way I see this, is an equal protection issue. And until we have someone certified, like everybody else in every industry, in every segment across this state, and we're going to let plumbers do it for them, then they do it for everybody. And that's the way I feel about this. I love this bill otherwise, but I'm going to vote no on general principle just because of that one provision, unless we take it out, and I suggest we do that. Thank you.
Well, Representative, I would just say to you, number one, I love your passion on this subject, and I don't disagree with you. The good news is the codes are all the same. Whether the plumber or whether the sprinkler contractor installs it, the codes are all the same. So in that way, we do have universal application and equity, in my humble opinion. And if we do nothing and we are under the pre-existing system which now exists, we're just ended up with a bunch of facilities that don't have any sprinklers at all. Thank you, Mr. Chairman.
Uh, You're recognized.
Well, if we do nothing, sir, it's because of this provision that you're keeping in there. So don't put that on me. It's on you. And I would say this, if it's up to codes, then we should let anybody do it. The homeowner can do it themselves as long as code signs off on it. Is that not correct?
It's a fine argument for deregulation. I think someone who has no competence on the subject probably would not be fit, but a plumber, however, who otherwise can lay lines of the sort, makes sense to me that it's closely related enough, or at least it is in the Department of Commerce's eyes, who regulates these things, which is good enough for me.
It's good enough for you, but the
You're
plumber's not certified. And we're talking about certification, which brings me back to it's certified for everybody else unless you have a disability in a home, then it's okay. So you've got to get rid of this provision. Thank you.
Representative Hicks, you're recognized.
Thank you, Mr. Chairman. You know, speaking from someone that's been in the building business for 41 years, I do believe that any qualified plumber can probably install sprinkler systems. It's not over the top hard to do. I truly believe that. I believe that they can do it in a more economical way, very much so, than a bigger company. I'm not even sure at this point in the world that we live in today whether you could even get a larger company to come out and do these jobs. As a matter of fact, that could be a part of why this is being brought in this posture. You know, I believe that that codes, especially where I'm from, I do believe that codes takes care of any malfunctions that would be. You know, I think that the plumbers will very easily go into these facilities or these homes, evidently, and I think they'll do a good qualified job. As a builder, I'm always concerned you give the state an inch and they take a mile. That is my concern. But that's one reason I'm here, to keep everybody reeled in. So we, you know, but I have full confidence that, say, for instance, my plumber could go in and do this job in a very timely, in a very good quality, and in a very just a way that would probably save these folks a lot of money. And that's probably what a lot of this is. And just trying to, in the world we live in right now, just trying to get somebody to do it. So I hope that helps the committee out just a little bit, but I'll be in favor of this because I think it is an issue that we need to deal with, and we need to deal with swiftly. And then we need to build on it. We need to gather information and do more work on this issue.
Yes, sir, Representative Hicks. I never thought about this bill as a jobs bill. That's an interesting perspective, but coming from a man who has done construction for 40 years, there's a lot of credibility in what you're saying. So thank you for the comment. We agree. We believe that's practical. We believe that's common sense. It's good to hear it from a subject matter expert. Thank you, sir.
Thank you. Representative Freeman, you're recognized.
Thank you, sir. And to my fellow contractor, I appreciate your words, but I'm going to add another piece. And while I do believe that the plumbers are competent and capable of running the lines, the difference is head placement, is spray application, is the zones that they're going to go off, that make sure that we're going to have the right coverage in a room that a traditional plumber is never going to have dealt with. Furthermore, a traditional plumber is going to run the majority of their lines on the interior of the house, coming from the bottom up. A sprinkler system is going to come from the top down. So we're going to need somebody that is familiar with the specific application of a sprinkler system, running pipes in potentially in an unconditioned attic space, to make sure that we don't have pipes bursting and freezing. I think that my colleague from Davidson County also brought up the point of if it's good enough for somebody who is disabled living in a house, it should be good enough for me. I have a sprinkler system in my home, and I no idea the difference in price from a plumber versus a licensed sprinkler installer, but I do know, and I've installed many. Every project I've ever built has a sprinkler system, and there are great differences. So comparing the two, while it may seem similar, and it is similar, it is traveling water. The nuance is what makes all the difference in the world. It's why they are currently licensed. It's why we currently have a separate engineering review. It's why we have a fire inspector come in and inspect it. We don't have the plumber. The plumbing inspector does not inspect a fire sprinkler system. These are all reasons that it is extremely different and nuanced. And I agree with many of the comments that I've heard. If we strip this out, this is a great bill. If the problem is coming up with the extra money from the state to pay the additional cost, if that's what it is to pay for an expert, I'd be willing to figure out how to come up with that additional money, because these people deserve to have exactly what I've got in the best manner that they can get it. So anyway, with that,
Well, thank you, Representative. I would just say that it's very rare probably that any of us can afford to put sprinklers in our own home, but for those who can, even if you can, you got to use the licensed sprinkler contractor. And to your point, how we ended up with over 100 unlicensed facilities that don't have sprinkler systems may be really a result of overregulation. Maybe at a future point, we should start looking at how we can make this easier for the sprinkler contractors as well. But unfortunately, we just don't have enough of those folks to go around, is what I understand. And I think the people who live in the rural areas understand that issue. Thank you, Mr. Chairman.
Any further questions for Mr. Dunn? Okay, seeing none, I'd like to bring up Gary Farley. You were on the list, if you can. Speaking to the microphone, tell us who you're with and who you are.
Thank you, Mr. Chairman and members. Got a statement here. I'll just read off, and hopefully that'll answer something.
Push the red button. And if you can, keep it to, I try to keep the presentations to 3 minutes, and then we can ask questions afterwards.
All right, can you hear me now? All right.
Yeah.
Section 2 of the bill allows licensed sprinkler, either LLP or contractor-based contractor's license requirements to install NFPA 13D sprinkler systems in group homes with 5 or fewer residents. For a group home with 6 or more residents, a commercial sprinkler system installed by a sprinkler contractor will still be required.
Here, I'll take one. Mr. Chairman, I'm going to sit down and let this gentleman use this one.
Sorry about that. The 2012 International Building Code currently allows NFPA 13D sprinkler system, which is a residential sprinkler system in a group home with 5 or fewer residents. Current law requires a fire sprinkler system contractor to install all sprinkler systems in Tennessee, both residential and commercial systems. The proposal would allow a licensed plumber to install these NFPA 13D systems, which are only allowed in non-commercial residential structures. The Tennessee Fire Sprinkler Association opposes this legislation, saying that Section 2 of the bill allows unqualified contractors to install sprinkler systems. The State Fire Marshal's Office does not support allowing unqualified personnel to install sprinkler systems. The bill, however, would allow a licensed plumber to install the residential sprinkler system in accordance with NFPA 13D, using the domestic water supply. NFPA 13D allows materials and methods that plumbers are familiar with, and the systems would still require an inspection to verify that it was installed correctly, an inspection by a fire inspector. The State Fire Marshal's Office does not consider this change to put vulnerable adults at risk, but it would lower the cost of installation, allowing more small group homeowners to comply with building code requirements. In the last year, we have found approximately 107 unlicensed group homes that would have required sprinkler systems to become licensed facilities. As of March the 15th, there are 211 sprinkler contractors that are licensed to do business in the state of Tennessee. Also in the last year, our office has worked with several large commercial venues that required sprinklers, but had been built without them. Both the property owners and my office struggled to get licensed contractors to return phone calls and even give us quotes. There is enough new construction that the contractors can pass on these smaller retrofitted jobs. There is a significant need for safe and affordable housing options for elderly and vulnerable adults in Tennessee. The State Fire Marshal's Office supports the administration's effort to ensure that these homes are licensed and safe for the residents, especially safe from fire hazards. If my office thought that this bill would put vulnerable residents at risk, we would not speak in support of this bill. But my office believes that this bill is a reasonable solution to a serious problem, and that a licensed plumber can safely and more affordably install the NFPA 13D system in group homes. And I'll take any questions.
Thank you. Speaker Marsh, you had asked to speak to him, so you're first on the list.
Thank you, Mr. Chairman. Thank you for being here today, Chief Farley. And do we have plumbers out there that would want to do this and that could do it? And what would be your estimate of the difference in the price from a certified licensed sprinkler installer and a plumber?
I think there are plumbers out there that would want to do this. It'd have to be advertised and let them know that this is an alternative. Based on what I've seen, I think it would be more affordable for the 13D system, a domestic system, could be more affordable done by a plumber than it would be a licensed contractor. Because what happens is a commercial licensed contractor putting in sprinkler systems, the bigger jobs, the commercial jobs, that's where their money is at. Because what they're going to have to do, they're going to go in and retrofit these homes that are 107 that are out there. That's going to be, it's harder to do that instead of doing it under the construction. That's what I'm hearing from licensed contractors now on some of these jobs. We've got wedding barns and things like that that have been built without sprinklers, and they really don't. They got more work to do, and then come out and retrofit something. So I think it would be less cost.
Right, Leader Gant, you recognize?
Thank you, Mr. Chairman. So, Commissioner, thank you for being here.
Yes.
So when a fire inspection is done on an application like we're talking about, you're going to find that problem if there's an installation by a plumber or another contractor, usually in most cases. Is that correct?
Yes, sir.
And you're going to make sure it's addressed before anybody is in that, building, correct?
Yes, sir. There'll be a bucket test that will be, the water will be flowed, a bucket test to see if everything is working. And then if it's not working, our people or any other local jurisdiction fire inspector will not sign off on something that's not going to work.
So it's going to be tested before anybody inhabits that building.
Yes, sir.
Thank you.
By a fire inspector.
Representative Mitchell, you recognize?
Yes, sir. Thank you, Mr. Chairman. Will, when a sprinkler contractor has to go out and get his insurance, he has to notify them they will be doing this type of work. So they have to pay a higher premium. Is your office going to require that those plumbers notify their insurance to require them to get the additional coverage that, their premiums are going to go up as well because, there's going to be more risk now?
What?
You recognize?
That would fall under the contractor's board. That, as far as the plumber's license, would not fall under the State Fire Marshal's office. So that would be a question that I couldn't answer. It would be more of a contractor's board to answer that question, sir.
Representative Mitchell.
Yes, sir. And, we've heard a lot about money and cost and people's ability to put sprinklers in and, not a lot about safety and life and health. And I think that's more of your role. I thought the other role was taking care of our aging and helpless population, disabled population. But wouldn't a place that has a sprinkler system, wouldn't their insurance rate in a good sprinkler system, wouldn't their insurance rates be a whole lot less than someplace that doesn't have a sprinkler system?
Well, first of all, I think a 13D system is a good sprinkler system, and I think sprinklers do save lives and are a safety mechanism that is good. So I didn't catch the rest of that question, sir.
Wouldn't the insurance premiums be a lot less for a place with a sprinkler system than a place that does not have a sprinkler system?
Well, as far as insurance, I really couldn't answer the question as far as lowering insurance. But what I understand, having a sprinkler system inside your home or any commercial building or whatever does give points to lower your insurance premiums.
You recognize?
And you probably answer this question because, got a lot of fireman friends, and they've told me, when they get a call and they say it's a place with a sprinkler system, most places they have to run in, they're not even at a brisk walk with a place with a sprinkler system because most of the time the fire's out before they get there. So, the safety of these folks, I think, is paramount. And, I've just never seen a bill. I've seen a lot of registry bills up here, and we're setting up a registry. This seems to be, a catch-all bill that, hey, we'll slip this in. And, from your time in your position, changing law like this, hasn't it most of the time been a standalone piece of legislation to do something this dramatic?
Well, here's the thing. On these 107, my personnel are the ones going out and doing these inspections. I have actually had to, a couple, three of them, I've actually had to shut down because they could not come up and it was so bad. I've had to shut them down. One of them is.
Thank you.
In his area. But here's the thing. If something's not done on this 107, these are not going to be sprinkled. So it's either get them sprinkled by another mechanism or they not be sprinkled and somebody die in one of these facilities. And God forbid that ever happens.
You recognize?
What if someone dies from a faulty sprinkler system that's installed? Then right now, it wouldn't be our fault because we've created a licensure system for a qualified sprinkler contractor to put in a license system. But if we do this and someone dies, it's our fault then.
Someone, sir, I'm
You
sorry.
recognize?
Someone could actually die in a commercial building and has died in a commercial building more than likely with something faulty, because anything that humans install or do, there could be faulty things happen in anything. But I would say that there could be something happen in a commercial building that was faulty that could, the same thing. So, but the thing is, if we don't do something now with these facilities, and I'm speaking from the life safety standpoint of it is, these facilities are not going to be sprinkled because there's not enough contractors out there that are able to get to them to do it.
Representative Mitchell, you recognize?
Yeah, so there's 107. So was it a requirement on the front end that they have sprinklers systems in there?
Yes, sir. Per code, anything 5 or under in a group home, they're required and they are allowed to have a 13D system. Anything that is 6 or more moves up to the 13R system, which is a more stricter. Or if buildings get bigger, it goes to a NFPA 13 system, like Mr. Freeman's, some of his buildings that he's built.
So how are they operating in the first place then? If they were required to have a sprinkler system in the first place, and now we've got all these people in these homes, and they shouldn't have been operating in the first place.
Well, that's why they're unlicensed. I
Well,
mean, they're not supposed to be.
So instead of shutting down 2 or 3, I think we're about 90 something away from getting there.
If I might just add on to
You're recognized.
Chief Farley here. I would say I mean, this is really what this is about. So the registry, the registry, that is the bulk of this bill. That is the bulk of this bill. But the provision in there, and I think this is why the DA's conference has decided to support this bill. If a person is on that registry and they continue to operate subsequent, because what we find is, and we want to encourage people to be licensed. We want more of these places that can house these folks, not fewer, right? So we want them to come into compliance. But the idea is that if you're on that registry and you operate subsequent, you then become subject to the Class D felony. We're going to get at the worst of the worst. I'm telling y'all, there are people who literally move around this state and use different people and set up pop-up places. We try to shut them down, and then they go to other places, pop them up. I mean, so that protection is in place. I don't want to lose sight that this registry and protecting these vulnerable people is really what this is all about. So I really think that the Department of Commerce should be commended, because what they're trying to do is offer up a solution that will result in more facilities being able to be in compliance and be licensed. I believe that's the reason for the provision. So thank you, Chief.
Chairman Jernigan, you're recognized.
Thank you. Chief, my question is, do we need certification at all? Because if you're going to check it out and Codes is going to check it out, why do we still need certification?
You're talking about
Across the board.
Well, right now, a licensed plumber has to have a license to operate as a licensed plumber. And a licensed sprinkler contractor has to have a license to act as a sprinkler contractor. What this does, it gives the authority to allow a plumber to do a sprinkler work. Right now, they're not approved to do that.
Well, my question is, sir, is there are certified folks that put in sprinklers, correct?
Yes, sir.
Why do we even need them to be certified anymore? If you're going to look at it, Codes is going to look at it. Why should they be certified? Why don't they just do it?
Well, we look at it. We look at all of them. Fire inspectors look at all, whether it's a commercial job or
Would
residential.
your office be okay getting rid of certification altogether?
No, sir.
Why not? You're looking at it. Codes is looking at it. At the final end of the day, as long as someone's licensed to do it, why should they be certified?
To know who is a licensed.
Just why should they be certified to put in a sprinkler system?
To know
Specifically. What?
To know who they are. And
Well, you know who they are. They're licensed to do the job. My point is, it sounds like that we're arguing against certification of the sprinkler system. If you're going to look at it and inspect it at the end of the day, Codes is going to look at it and inspect it at the end of the day. Someone's licensed to do it. What's the point of being certified?
Let me ask something here, if I can get a clarification on this for a second. So explain to me, there's 13D, is that correct? And then there's a 13, and then what's the other one, 13R?
There's a 13D system, which is for domestic water, potable water and all domestic. That's the lowest level of the 13 NFPA 13. Then there's a 13R. Like, for example, in a 13R, you have 3-story apartment complexes. That would be a 13R system. Or if you had a factory, that would be a NFPA 13 system.
So I guess the question, for the chairman was asking to give me clarification. In this situation is a 13D, and he's asking about certification. And would you be saying that someone needs to be certified for the 13R and the 13, but this is specifically allowing a non-certified person to install a 13D? Do you believe that someone needs a certification for a 13D? are there caveats beyond that?
I believe that a plumber could use and install a 13D system. A 13R and a 13 system, it needs to be a licensed sprinkler contractor.
Right.
Because you're
Thank you.
getting in more.
Why?
Thank you, Chairman. You are recognized.
Thank you. Why would they
You're
need to be
recognized.
certified?
Because a 13R and a 13 system are more complex than what a 13D domestic system is. A domestic system is just like installing your potable water, and your water already that the plumber is already installing in a residential structure, 1 and 2 family home.
But at the end of the day, whoever does it, you're still going to go in and certify to make sure it's done. So is codes. So it didn't seem to me it matters who installs it on the front end. As long as they're licensed, they don't have to be certified, right?
But this is only for the 13D system for plumber is only for residential group homes with 5 or less.
I understand that, but certification, it doesn't seem to me that we need, the way that sounds like coming from your office, that we don't need certification as long as you all and codes are there to approve it and make it right.
No, sir, I don't believe that's the way I was saying it.
You said that, well, we're going to go in and make sure, codes is going to go in and make sure. So I don't understand the role of someone being certified.
Well, it's no different, and I'll use Representative Hicks there. He's a licensed general contractor.
Uh-huh.
He has inspections. So with that being said, your example, we wouldn't need him to be a general contractor, which I disagree with.
Well, why couldn't he put in the more sophisticated system? Even though he's not licensed as a sprinkler to do so, but he could put it in. At the end of the day, you all are looking at it, codes is looking at it. So I don't understand. It sounds like that we don't even need a role anymore for certification.
I don't think
that's what it sounds like you're advocating for.
No, sir.
I disagree.
I disagree with that, sir.
All right.
All right. Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. I guess I need some clarity. I've heard I've heard both witnesses reference what the sprinkler system is capable of in this time frame that we're in, and whether they have a concern, a problem about this. I want to know if there's any representation from the sprinkler system companies that could speak for themselves as opposed to our present witnesses speaking on their behalf.
I think there is somebody here that could, from the sprinkler industry, that could answer your question, I would believe.
We do have somebody here from them that they're next on the list,
Okay.
and
All right.
I'm
Thank you.
hoping to have them up here, and it's my plan to have them up here. So,
Thank you, sir.
Representative Hicks, you're recognized.
One quick question. I think this is very important. In a percentage, how many of these places are in rural areas?
I don't have the list in front of me. I'm thinking there's probably 85, 90% of them.
I would say that's accurate. If you would like, we can get you more specific information, but the majority of them outside, we've had quite a few in Memphis. Outside of that, the majority of them are in rural areas.
And would you agree that that is sort of part of the issue in getting someone out to those rural areas to try to put these in? I mean, I know Mr. Farley, know him well, and he is really trying to work with the state on this because, I mean, he's really done a great job in trying to take care of this issue. I can tell because it's in the rural areas is the big issue here. You will never, a lot of us don't live in the rural areas and don't understand the situations and the problems out there trying to get people to do stuff. So that is a big issue with 85 to 90% of it being in the rural areas.
Well, and I would say that some of these sprinkler contractors, if they would come and do the job, like someone in from Johnson City in that area, I mean, they may travel further out, but I would assume that some of them might want to do that if we could get some people out there to do these jobs is the thing.
You know, I would say too, Representative Hicks, if y'all should pass this bill and Section 2 be in it, there would be nothing, I'm not aware, I mean, you could speak, I'm not a subject matter expert on, but I don't believe that there would be anything that would preclude a sprinkler contractor from hiring plumbers so that maybe they could further work in these extended rural areas. I don't know. I don't know.
That would be somebody from a contractor have to make that decision. I would
Representative
say.
Byrd, you're recognized.
Yeah, in rural counties, especially in Wayne County, we consider anyone that is willing to crawl under your house, licensed, and so we get what we can take in Wayne County. But I've got a guy that he's done my plumbing and electrician for years, and he's got like a 7th grade education, and I would trust him with anything like that. I think it boils down to experience more than it does that piece of paper anyway.
Thank you. Any further questions, Mr. Farley? Okay. Chairman Vaughn, or? All right. All right. Seeing no further questions, thank you guys for your testimony. We do have Brian Briggs from the National Fire Sprinklers Association.
Thank you, Chairman, members of the committee.
And just for the record, tell us who you are, who you're with, and make sure that microphone's on.
Thank you, Mr. Chairman and committee members. My name is Brian Biggs. I'm the Executive Director for the Tennessee Fire Sprinkler Contractors Association. So we do completely understand the importance of this bill. As we spoke with Representative Eldridge earlier, we do support this bill completely. It's very important, and it needs to be tracked. They do need to be identified, but our position, we do oppose Section 2, as several of you have spoke. We think it should be equal. I mean, you have a state law in place. You're lowering your standards to allow someone that's not trained to do a job. You're sending out a certified inspector to inspect a non-certified system. I understand the inspection side of it, and as I've done that for a long time in my previous role as the deputy fire chief, so I understand what it's like to do the inspection side. But my contractors are certified, and this is their profession. As Representative Freeman said, my contractors know what the sprinkler heads are designed to do. They know the placement. They know the density. They know the shadowing areas that the heads will do and work. I'm not disputing that the plumbers can't get the water to the head. Absolutely agree. They can do it. They can get the water to the head, but they don't understand the design of it. Sprinkler systems are designed for life safety in this situation. This building here has a 13 system in it. It's designed to protect the building. We're talking about life safety here. 13D systems are designed to save lives, not necessarily the buildings. And the 107 homes that have been addressed, we do have contractors that work in rural area. In Representative Eldridge area, Morristown area, we have Morristown Fire Sprinkler Association, or Fire Sprinkler Company. Kenny Rogers runs it. So we do have contractors all across the state. As Chief Farley said, there's 211 registered sprinkler contractors across the state. We have personally spoke to several of our contractors who do work in rural areas. But retrofitting any project is always costly. Doesn't matter if you're going in and doing any type of work. You've probably all remodeled your house at some point. If you'd have done it on the front end, it would have been a lot cheaper. But anytime you do any type of retro work on your house, it's going to cost you a little more. So, but as far as the State Fire Marshal's office, we understand they do a great job. They ensure that every company that's installing fire sprinkler systems right now are trained and properly licensed and certified per the state law. So there's a reason that their policies are in place and their laws are in place, and that's to protect the citizens and the visitors of Tennessee.
Thank you. I've got a few members that want to ask some questions. Chairman Vaughn, you're recognized.
Thank you, Chairman. Sir, I've heard today that codes prevent us provide the specification and prevent us from having faulty installations, and that the fire marshal's review takes care of any deficiencies. Have you found it in your past experiences that the inspectors come in and help you resolve your issues, review your design, find the points of fault, and work with you to resolve those issues, or do they merely give you a pass-fail grade? That's one of the things I'm concerned about. I know that in my jurisdiction that our inspectors constantly tell our licensed contractors that they are not there to supervise them. They are there to review their work. The other issue is, how much work on the front end do you do from a design perspective?
Thank you, sir. You are correct. Yes. First off, I'll answer your first question. Typically, it doesn't happen this way because our wonderful home builders that y'all do get a relationship with your inspector. And a lot of times they will come in and say, you need to move that header over. You need more brace. You need more supporting. You need this. That's why I'm going to red tag you today. Technically, they're not supposed to do that. They're not supposed to tell you how to correct your problem. They're supposed to tell you what the deficiencies are. And to answer your second part of that question, it takes in state of Tennessee 3 to 5 years to become a licensed sprinkler contractor per your state laws that require that. So, and that's to understand the design of a system so that you understand how the sprinkler head is supposed to react during a fire. A plumber, there's so many different heads on the market. Every head is designed to do different things for a different application. And there's a residential fast response head that would need to be put into all these facilities. And who's to say that if they put in a commercial head, one wrong head could be the difference between a life, between someone not understanding how the systems are designed.
Thank you. And for the members of the committee, we are at our allotted time. So I appreciate your testimony. With that, we're going to have to go back into session.
Yes, sir.
Without objection, I would take a motion to adjourn. Okay, without objection, we're adjourned. All bills will be rolled to next week. Remaining bills will be taken up next week.